What would they say about you?
What a great start. What would my friends say? Most of it I probably couldn't say on record, but those that know me, I guess professionally, as we generally have our professional friends become our personal friends, they probably would identify me as as the movement advocate, meaning that everything that I generally, when anyone asks me anything clinically oriented and ask for my advice, I generally usually come down to some form of movement. So they typically say, you just advocate for movement. And I say, why wouldn't I? So I would be known as the movement advocate. My practice situation right now is unique. I've recently moved several times from different states. I was practicing in California for 13 or 14 years, moved to Denver, Colorado for an opportunity, practiced there for another 3, and now I'm in Austin, Texas. And when I moved here, I decided to liberate myself from a brick and mortar traditional clinic to having it be what some people would call concierge. I just considered it a remote or mobile practice where I have a van. I end up being where my patients want me to be, typically at their homes or their training facilities. At the horse ranch recently, I've been treating some riders at the ranch itself, and
Cool.
it's been amazing. So a mobile facility. Yeah, so I'd say the majority of my day is spent with developing, I guess, innovating new products for our profession in particular, and attaching those products with education to allow us to better understand why they work and how to use them.
Okay.
A good question. I would have never stood. And I actually get a little bit of anxiety just speaking to you through this medium, but
Mhm.
I never saw myself standing on stage speaking. Definitely not speaking to my peers. So I didn't envision this as a student. I did see myself in the sport and movement arena. I knew that I wanted to be able to leverage my passion for sport, passion for moving my body or moving bodies in general. So I knew I wanted to be in that space, and I think um, unconsciously or subconsciously, I probably positioned myself to be the expert in that space, which afforded me, using that word once again, the opportunity to meet the right people that put me in the position that I'm in right now.
Mhm.
What I was saying earlier is that the commitment of being the expert requires, time in the books, time, researching, time spending refining your skill of speaking and communicating the message, and all of those put together really put you in the right place at the right time. So there's work that leads up to that opportunity. And so I think we say it flippingly and modestly saying, right place, right time, but there's a lot of work that's put in to put us in that position. That's a great question. And I really haven't thought about it in depth, but, quickly, as you're even asking the question, I start thinking chiropractic, in my opinion, and I work with a phenomenal team of different professionals, physical therapists, athletic trainers, massage therapists, occupational therapists. The clinical team that I have is beyond anything that I would have ever considered myself to be part of. But what I find that creates some distance between the chiropractor myself and the rest of my team is that I believe that chiropractors, and a lot of people will consider them, and it's probably more of a negative connotation, that we're the lowest hanging fruit. And what that generally means in respect to the industry is that we generally adopt new things a little bit earlier. And I don't necessarily believe that that's true. I believe that we're open minded and and curious enough to be able to accept some new things in the scientific world that are safe and effective. And I think that we're open and curious enough to be able to adopt them, test them, and then continue to understand them over the time that we apply them. So I think that my chiropractic degree and my chiropractic uh, experience has really opened my eyes to looking at things like fascia, for example, that would generally have been disregarded as significant when it comes to pain and movement. And now, over the last 12 years, the research has caught up, and it's now supporting the theories that I was presenting well over a decade ago. So that I believe is what chiropractic has provided me. I believe that my chiropractic background has again afforded me the ability to be that innovator, head of the team, because I'm typically looking at things again with the mindset of how could this product alleviate the stress on our bodies as chiropractors, as generally we're using our hands. So I'm always thinking of how I could mitigate the stress on our body, but to be as effective with a tool. And I do so partly because of my own experience in my own body, as well as my classmates. I had a small class, but unfortunately, and the research is supporting this, is that many of us get out of practice far too early because of orthopedic musculoskeletal issues due to the laborious nature of what we do for a profession. So what I was hoping to create, things like instrument assisted tools, which is not a unique instrument. It's just how we introduce this instrument and how we educate people on using them with a less is more approach, using what the clinical science and the application science is telling us. That I believe that things like an instrument assisted tool of what we've been able to develop within Rock Tape and how we deliver it to our audience, which includes chiropractors, has really been one of the best things that I've done in my practice years, because I know I've helped hundreds, thousands. I don't know what the number is, but I'm really thankful for the opportunity to be able to help my profession be able to do what they do for a longer period of time. So I think
Yeah.
this is what chiropractors need to do more regularly, is voice what we can provide to the industry, to our patients, and to the world as a whole. So I know that's a grand statement, but I'm just really thankful to be able to educate someone that chiropractors should be in that space, at least
Yeah.
in the DoD.
Wow. What an opportunity. So